Hello, and welcome to the Aquatics program at Progressive Physical Therapy, where patients experience the healing properties of water and regain control over injury and illness. The pool is specifically built for rehabilitation and remains at 92 degrees, with depths from 4 feet to 6 feet. This allows patients to experience decreased weight bearing, decreased pain, decreased muscle spasm, improved movement and stability, which promotes improved range of motion, improved strength, steadier gait, and higher overall function for progression to land. The aquatic environment is appropriate for patients who may be experiencing chronic pain, back pain or spinal dysfunction, pre- or post-op surgical patients, gait or balance deficits, fibromyalgia, arthritic pain, lower extremity fracture or injury, high body mass index, and joint pain. Patients such as Sue, whose ankle fracture gave her difficulty getting around, Charlie, whose back pain due to spinal stenosis didn't allow him to sleep through the night, and Bill, who had difficulty regaining range of motion following joint replacement. The benefits of the aquatic therapy environment are often profound. The various properties of water allow patients to experience starting treatment sooner after injury or surgery, reduced inflammation and swelling, relaxation and reduced pain, decreased muscle tension and spasm, improved flexibility and range of motion, decreased weight bearing and unloading of the joints. 25% of body weight at chest level and 50% of your body weight at midsection.
After a severe leg and ankle injury, I came to Progressive Physical Therapy, and the therapist provided a comprehensive, personalized treatment and plan. Enjoy life, definitely move forward, and I'm very grateful for all the help, therapy, and support.
The properties of water allow patients to experience these benefits and provide a unique therapy environment that you are unable to experience on land. Buoyancy, the upward force that acts in opposition to the force of gravity. This means that the deeper you are in water, the less you weigh. This concept is important for individuals with weight-bearing restrictions. The buoyancy properties of water can help to assist with movement, resist movement, and support movements on the water's surface. At any depth, the amount of pressure exerted on all surfaces of the body is equal. This results in equal pressure around the joints during aquatic exercise. Due to this, a patient should experience increased support when in the water. It can also be helpful for patients who have excess edema or swelling. This also applies to pressure to the chest wall, requiring increased muscle work from the muscles that participate in breathing. This increased work can help to strengthen these muscles and increase the patient's cardiovascular capacity. Viscosity helps us to create resistance in the aquatic environment. Water is more dense than air, creating more resistance as you move through the water. By increasing the surface area with use of an object, this can increase the resistance a patient may feel during an exercise. Then, by increasing the speed of movement, more resistance can be felt due to increasing the resistance in the water. Aquatic therapy pools vary in temperature. Our therapeutic pool rests at 92 degrees. The warmth of the water helps to lessen pain, increase blood flow and lymph drainage, and helps to relax muscle joints and the person's mental state. This relaxing environment can promote a reduction in muscle tone. Although the pool is a great medium for certain individuals, it is not right for everyone. Some aquatic therapy restrictions include incontinence, history of uncontrolled seizures, recent heart attack, open cuts or wounds.
I've been coming to Progressive Physical Therapy for several years, first of all for some knee replacement therapy and my hip replacement. But about a year ago I had a back problem, lower back problem, and I came into the aquatic part of it. And I was apprehensive at first because I thought the exercises were so simple that they weren't going to do me any good. But after being here for a couple of weeks, it's just get better and better, and by the time the therapy was over, my pain was completely gone and hasn't come back at all. I'm really glad I came to Progressive.
The following are examples of how we incorporate our interventions in the aquatic environment. In the supine float position, the patient's joints are unweighted and accessible to the therapist. Manual techniques can be performed in this position to enhance spinal mobility and movements. Proprioceptive neuromuscular facilitation can also be performed in this position to encourage functional movement patterns as related to both the upper and lower extremity. The technique of bas de gauze is administered in this position and can be used to improve motion, decrease pain, and work on core stabilization. Buoyancy provides an uplifting force from the water. By using buoyancy, we create resistance or assistance in the aquatic environment. If a patient is having difficulty achieving shoulder abduction, this exercise is assisting. If the patient needs shoulder adductor strengthening, the force is resistive. By increasing the speed of movement or the surface area in the water, you can also increase the resistance. Another example of buoyancy-assisted exercises are using the noodle for hamstring and quadriceps stretching. This technique can also be used on patients needing passive stretch to improve range of motion. The uplifting thrust at the end of the lever arm promotes improved mobility. Balance can be tested in the water by adjusting the properties of the water. When standing still in the water, there is support from hydrodynamic forces to ease the movement. By making turbulence in the water, you are changing the direction of the forces and creating a more unstable environment to challenge the patient's positioning. Use of objects such as a noodle can also help to advance the exercise and challenge the patient's balance by adding a more buoyant and mobile surface. The pool is also a great environment for non-weight-bearing and strengthening activities. Deep water exercises can promote improved lower extremity motion and strength without weight throughout the joint. By increasing speed and resistance, you can also increase workload and promote improved cardiovascular conditioning. This patient is performing hip flexion and extension exercise for strengthening and core control. A unique exercise for the aquatic environment is deep water suspension. By staying suspended in the upright position, it allows for the joints to unload, creating relaxation of the joint and surrounding tissue. Weights can be added to the patient's ankles to provide traction, which is a good position for patients with disc issues that have difficulty tolerating land traction due to the weight or positioning. The warmth of the water creates an environment that relaxes muscle spasm and warms tissue to allow for us to help achieve increased range of motion with manual techniques in the aquatic environment. Often these are used following surgery or injury. Our aquatic treadmill allows for patients to continue with cardiovascular training when they sustain injuries or have pain. Research has shown if you work at a rate similar to what you do on land, aquatic exercise can increase your VO2 max and help to sustain cardiovascular function. It is also a good way to assist patients with gait training post-stroke, lower extremity fracture, or patients with balance issues to restore a more normal gait pattern.
For 28 years, I've been coming to progressive physical therapy. Started out with problems in the cervical spine. I recently experienced a total knee replacement, and there was no doubt in my mind as to exactly where I was going to go. The aquatic therapy at Progressive was one of the most fantastic things I've ever experienced. It expedited my recovery, and I feel that the personnel here, the therapists, are some of the best that I've ever seen.
Why Progressive? Our pool is designed specifically for aquatic rehabilitation purposes. We combine physical therapy exercises and approaches with properties of water. We're the only pool in the area with an aquatic treadmill, provide hands-on supervision and instruction from licensed therapists with a combined 30+ years of experience in aquatic treatment, incorporate a land and pool approach, varying depths to allow both shallow and suspended water exercises. Thank you for joining us today. We hope that this information was beneficial to you. Remember to keep the aquatic program in mind as a good treatment option for both you and your patients. If you have any questions or would like to try aquatic exercise yourself, please feel free to contact us here at Progressive Physical Therapy, and remember to keep moving.